We'll move to the next category of drug, which will be given an introduction preamble to, and this is what is known as the antidepressant drugs. So for antidepressant drugs, it's more of like you introduce what is antidepressant drugs, you talk about the various categories and the examples that fall under these categories and how they work, all right, and maybe the type of disease conditions that they are now used in treating. So for the antidepressant drugs, of course, you know depression, right? It's like you're just feeling low mood. Like for me now, I currently have issues with some of my other YouTube channels. I'm not really feeling strong, but I just said let me work, because if I don't work is going to pile up for the next time, you know. So antidepressant drugs, you should know that they are drugs used in treating depression and other mood disorders. Okay, so the most important aspect of this lecture is trying to look at all the classes that fall under these drugs, and of course the examples of the drugs that fall under each of those classes. Okay, now each of those drugs later on we'll come back and talk about their pharmacology. So we have the SSRIs. Okay, that's a selective serotonin reuptake inhibitors. So those ones will have drugs like the Fluoxetine, we have the Sertraline, we have the Escitalopram, we have the Paroxetine. So this is Fluoxetine right here before our screen. So generally, how do these drugs work? So they block serotonin reuptake. So they do now make it that serotonin is so much in the synaptic cleft. That's basically that space between one neuron and the next. You understand? So if serotonin is so much there, it will now reduce depression, it will reduce anxiety, because it's kind of like triggers happiness. Okay, so for the next, you are looking at the serotonin norepinephrine reuptake inhibitors. Okay, a popular example known as the Venlafaxine. Okay, so for the Venlafaxine, we have another one known as the Duloxetine. We have the Duloxetine, right? We have the Desvenlafaxine. That one is kind of like an improved version of the word Venlafaxine. So these ones, they also block serotonin reuptake and also norepinephrine reuptake. Okay, so they block both serotonin and norepinephrine. So they are used in what? Treating depression and also generalized anxiety disorder, neuropathic pain. So those ones, you know, they'll trigger much more, you know, impulses. Then next we have the TCAs, which are known as the tricyclic antidepressants. So drugs like the what? Amitriptyline, amipramine, the nortriptyline, all of them basically fall under this category. Okay, I would say that on the general, these drugs will block serotonin and norepinephrine reuptake, and they also act on what? Histamines and acetylcholine receptors. So they can actually manage what? Depression, they can manage chronic pain, they can manage migraines. Okay, so this is Venlafaxine. So the next one we have the MAOIs. Okay, so these ones are known as the monoamine oxidase inhibitors. Examples of these drugs include the phenelzine, the tranicypramine, and the isocarbazazide. So these ones, they inhibit the monoamino oxidase enzyme, okay, and they will prevent breakdown of serotonin. So this one, they are against let nothing break down serotonin. Do you understand? So you have a lot of serotonin in the synaptic cleft, but as a result of it is not being broken down. You understand? So it's used in treating all those atypical depression and depression that's resisted other drugs. Okay, so atypical and miscellaneous antidepressants include things like the bupropion, okay, mirtazapine, and the trazodone. Okay, then other ones like the vilazodone and the vortioxetine. All of them are basically newer agents.